Hello, welcome back to Ministry.Mom.Medicine. I'm your host, Dr. Brittany Taylor, and I am so happy you're able to join me at my 10th episode where we're going to be discussing how depression is influenced by the mind, body, and spirit. As you all know, I like to tackle things from the biopsychosocial perspective. And when I say spiritual, I look at it from the lenses of me being a Christian and making depression applicable through those lenses of the Word of God. Disclaimer out there, this episode is nothing about information. It's informative. It is not meant to diagnose. It's not meant to treat. As you all know, when I discuss my episodes, when I talk about anything health-wise, I recommend you talk to your primary care provider, your own psychiatrist, your own therapist about any changes that you want to make, anything as far as you may think that you may have. Discuss it with them and ask them for the best advice that they can provide for your particular problem or case, okay? Again, this is only informative, where I hope that I can provide information where people can have more light about different issues. And so, as you see, I have a shirt on that is called Psych Signature. It's a business that offers ways to dismantle mental health stigma. And I think one of the ways that I can help foster an environment of dismantling stigma, helping address different things that happens within different communities, especially my community, is by offering information, free information, so that we can be informed and not misinformed and not easily confused. Okay, so that's what this episode is going to be about: depression, major depressive disorder specifically. And so if you have not followed me on Instagram or followed me on YouTube or Spotify, please go ahead and do that now. Like or subscribe, and be sure to comment. This definitely helps me understand if you're able to wrap your mind around certain things that I'm sharing. If you have any suggestions, please do that. So if you need to pause this video or pause whatever way that you are listening, do that now so that you can subscribe and follow me. And if you like this episode, please be sure to share with your friends or family so that they can also gain more insight and knowledge about different things that happens within the mental health field or within their own selves when it comes to mental health disorders, okay? So let's go ahead and get straight into it. As you all know, I am a resident psychiatrist. So one of the things that are part of my training is learning how to conceptualize different diagnoses within psychiatry, and we do that through looking at it through the lens of biological, psychological, and sociological or social factors that may be contributing to a person's presentation to me, different symptoms altogether. But as a psychiatrist, even through medical school, I learned some of the clinical symptoms that patients endorse when it comes to major depressive disorder. And some of the common symptoms associated with major depressive disorder, we look at it when I was medical school, we learned it through an acronym, but we can think about, some of the things that has to be there is that it has happened within, 2 week time frame. It is to the point where a person is having low mood or depressed mood, or just feeling, not feeling like their normal selves. And we also can think about when someone has anhedonia or decreased or diminished interest in doing things they once used to do, or if they're doing those things, they don't find pleasure anymore. Say for someone who was an avid golfer, someone who loves basketball, they're doing these things, but they don't find much fulfillment in it anymore. And so when it comes to those two, the person must have either one of those when it comes to me as a psychiatrist and diagnostic criteria. And then we also want to, investigate, how's the person energy levels. Typically, the person energy levels is going to be low. We think about, how are their thought patterns? Are they feeling like they have much more rumination on things that go wrong? Are they feeling like they're, guilty or worthless about different things? And it's time frame. All these different symptoms that I mentioned can be happening. It doesn't have to be all those ones, but it has at least, 5, have at least 4 of these different symptoms. And so also think about their sleep pattern. Decreased sleep is very common, but also some people have increased sleep where they just want to sleep all day. And after sleeping all day, they're still feeling tired, not feeling replenished at all, We think about, ask the question about the appetite. How's your weight? Is your weight increasing? Is it decreasing? Is your appetite changing? Where you're eating more, eating less? We asked about, family members, have they say, like, are you talking or moving slower? Or are they saying like you're emotionally agitated, like you're moving a lot, you're restless? And this is observed through like a family member or a friend telling the person that. Another thing that we assess for is like attention and concentration. Like typically when people are feeling depressed, it's like their mind, and I'm sorry if I sound a little bit different, but I'm under allergies. But typically their mind is kind of clouded and kind of processing things a little bit slower, so it's hard for them to pay attention and to have concentration on different things where typically it was easier for them. For instance, a person may say, typically I'm able to do my work at my job or do my homework, but now it's like it's hard for me to sit down and focus in on it because it's either a lot of things that run through their head or just their brain cannot process what it is that they need to perform or do. And then like the last thing, which is one of the most important things I assess for every time I see a patient, is I assess for any thoughts of like death, increased thoughts of death, increased thoughts of dying. And even if it's just, I'm thinking that life is not worth living to severity of, hey, I'm thinking about taking my life. And in those moments, that's where that's where the level of severity comes in when it comes to me diagnosing major depressive disorder. Because sometimes people can have a mild depressive disorder, where they can have a severe depressive disorder, where sometimes hospitalization may be required. And there's nothing wrong with getting help because your life is important, your family member's life is important, all of our lives are important. And sometimes major depressive disorder can negatively impact the way that one may view their life, and it can be viewed into a negative, skewed point of view that is not actually accurate. And so we have to assess, I as a psychiatrist have to assess those things. I also think that those who are therapists, they assess those things. Even pastors or even evangelists, they assess those things in a way that people can be honest with them, because some people judge, some people are not aware, are not a safe place for people to express their thoughts. I think that goes to what I mentioned, the biopsychosocial. Some social environments do not allow people to be vulnerable about what they're experiencing or thinking. I think that adds to what I'm trying to help dismantle is the stigma associated with depression in certain communities, that you cannot share what you're saying, because if you share what you're saying, it's going to worsen or intensify what you're already experiencing. And I hate for people to have to deal with major depressiveness on their own. You should not have to suffer in silence, so I think by the end of this episode, you will understand more. And if you are, someone who has a family member dealing with a major depressive disorder, if you yourself you're dealing with major depressive disorder, if you just want to be more informed, this helps you understand that it's more than just one thing. It's different layers to that. And so we have to be encouraging to one another and allow grace for everyone, because everyone doesn't have the benefits, everyone doesn't have the resources, everyone doesn't have the genetics, everyone doesn't have the same thing that goes into play when it comes to major depressive disorder. Some people don't have the ability to go to a doctor that's right down the street, or to a doctor that they feel comfortable with. And that's where we as a community, we have to help each other. We have to definitely be the support for one another. But like I said, unfortunately, some people do not offer people the space to be vulnerable and be honest, and so they're having to shoulder a lot of this burden when they're feeling like they're not their normal selves by themselves, and that intensifies the problem. I believe it multiplies it for sure. I've just did a presentation on mental health stigma, and we discussed how a lot of times, one of the main recommendations for stigma decreasing or being eliminated is through vulnerability, is through actually having social contact with other people. And that's where you can tell how sometimes in major depressive disorder, people socially isolate, they remove themselves from people, they try to deal with the things that they're dealing with on their own. I just talked about this in one of my, I think it was episode 8, where I talked about how the benefit of the church, how the church is a way where we can come together and encourage one another and be next to one another. But sometimes it's very much difficult to do that when some people are feeling depressed. Sometimes that's the way that they show that they are depressed, where they remove themselves. from people, but we have to touch and agree with one another when it comes to me and my faith as a Christian. Again, like I said, my podcast is definitely Christian based, but I hope you can learn how, especially if, say for instance, you're watching this video and you're not a believer, but you're someone who works in the mental health field. Maybe this can help you understand when you have someone who comes into your clinic or into your office and they are a Christian, how you can approach them. Alrighty, and so some things that's important considerations that I have to think about when it comes to me as a psychiatrist is that in order for me to diagnose someone with major depressive disorder, it has to cause impairment, okay? Meaning like it's affecting the way that they show up at work, it's affecting their relationships, it's affecting, socially, it's affecting something, okay? Negatively impacting them. You have to understand that I have to understand that other things can look like major depressive disorder. That's where me as a psychiatrist comes in, because my training is I have to look at the lenses of, could it be some medical illness, whether it's through low vitamins, whether it's through hypothyroidism, whether it's through someone has their own chronic illness on top of becoming depressed, where I would say maybe this is depression due to their chronic illness that they have, whether it's, diabetes, sometimes cancer, sometimes cardiovascular disease. All these different factors I have to think about when a patient is sitting in front of me that could be contributing to the symptoms that they may have. I have to look at different etiologies when it comes to why a person is having major depressive disorder symptoms, okay? The next part that is important for me to consider is that life events should make people feel sad, okay? Certain events that happen, certain circumstances, does not mean it's major depressive disorder. It could just mean that this was a very difficult event that the person is having to deal with, or stressful life event, whether it's a bereaving someone who has died close to them, whether it's, the fact of loss of job, whether it's financial struggles, whether it's environmental problems, whether it's, relationship conflicts, whatever it is, I have to investigate, is this just something that has happened within their life that is making them have symptoms like what I mentioned that I assess for major depression disorder? And if that's the case, it will take time and a different treatment modality. It wouldn't necessarily mean let's give you a medication, because the medication is not going to fix that problem. You know what I mean? The medication can help lessen some of the intensity of the symptoms, maybe help recover, decrease sometimes the negative thought processing that you may have as far as rumination, or maybe it can help decrease, the tearful affect that someone may have. That is definitely possible. But I have to investigate that, because it just may mean time. It may mean therapy. It may mean, support group. It may mean the other things, the other avenues for treatment for that person. And so I, as a psychiatrist, I have to look at those things, look at those lenses. And so certain things that I think is important for those who are coming across this podcast and they're seeing what I'm sharing about major depressive disorder. And I think this is going to be a series, you all, where I discuss various mental health disorders from the lenses of mind, body, and spirit, and how we can overcome together as a community. And so some risk factors associated with major depressive disorder that I've come across most commonly is the genetic risk factor, meaning those who have a first-degree relative who suffer from major depressive disorder are more likely to experience a major depressive disorder. And so I will quote some of the studies that I got that from, but we can see how that plays, especially if, for instance, I say all the time, nature versus nurture, whereas especially if you're raised in an environment with a parent who was depressed and you see the way that they're depressed, you see their affect, you see the way they dealt with different things, you're more than likely to copy or see how they responded to those things. And sometimes it's, nature-wise or the nurture-wise, just genetically, we are predisposed to it due to the way that our DNA has, been made up and the changes that happen. But the things that I love about being a doctor, the things that I love about my learning, my training, is that when it comes to our brain, we can go through neurogenesis or neuroplasticity, meaning just because we have learned a thing this way, just because our body has done a thing this way, there's ways for it to change, whether it's through treatment, through medications, through therapy, through relationship with God, prayer, support system, like I said, a support group, social contact, whatever it is, things can change within our brain if we allow it, okay? In certain instances, it's very difficult for that to happen, especially if someone has a history of having brain injury, having problems in a way that affects their ability to have plasticity in their brain. I have to think about how there are other influences for major depressive disorder, and so there's sometimes environmental risk. But I think with that, I'll wait to share that when it comes to looking at major depressive disorder from the lenses of psychosocial factors, because I explained to you, I think it was my episode 2 or 3, about how adverse childhood experiences can increase the risk of substance use disorder, but it also increase the risk of multiple psychiatric disorders like major depression, because adverse childhood experiences, like I explained to you all, it is any form of abuse in childhood, any form of neglect in childhood, any form of witnessing violence in the home, whether it's domestic violence, whether it's I'll just read some of the things, whether it's living with a parent who struggles or has problems with their substance use or mental health, losing a parent through suicide, parental divorce or separation, having a household member incarcerated or in prison or jail. And then we also have to think about some of the social determinant health factors. So won't go into detail about that just yet, but just know these are the things I think about. Could this be adding to why a person is having major depressive disorder? Because if I look at it just from the lenses of me being a doctor, just biological or just psychological as a psychiatrist, I could be missing things about socially what is impacting patients. So when it comes to my treatment plan, I have to figure out a way to address certain things that this person is having that is making them feel this way. Because if not, major depressive disorder is one of the main disorders that has a higher risk of someone attempting and completing suicide, okay? So it's very serious because when you miss certain elements of a person and you just try to super focus or hyper focus on this one thing, this has to be this one thing, and you miss this other important detail, sometimes you miss an important picture or an important part of a person, okay? And so that's where I as a psychiatrist have to do, but also think about you may be a family member or an individual who is suffering from major depressive disorder, and you don't fully understand why is it happening this way, why is it showing up. This is an opportunity through this video for you to see for yourself different ways and maybe take notes of what you think it may be for you, so you can go to your provider, you can pray about it so that you can find better treatment for what it is that you're dealing with. Alrighty, and one thing I want to say before we go into the biological factors that contributes to a person having major depressive disorder is that major depressive disorder does not discriminate. Okay, it's not just one individual, one set of people who experience major depressive disorder. Okay, major depressive disorder can be at any age. It can be bimodal distribution, of course, meaning like typically sometimes people in the 20s to the early 30s, and then 60s and up, sometimes commonly have higher rates happening, but anybody, any age can experience it. Any race, any culture, any gender can experience major depressive disorder, okay? It knows no name. It knows no subgroup. It's not stuck to one particular crowd, one particular group of people. Anybody can experience major depressive disorder. And that's why we have to understand that as a psychiatrist, I can't just say, oh, well, this person looks like this, so they can't have it. Or this person, they come from poor or wealth. They can't have it. Anybody can become depressed and have major depressive disorder. And so I have to think on that and consider all those different things. And so let's kind of go into the biological factors that can contribute to a person having major depressive disorder. And today, Dr. Taylor is definitely looking at some of her notes, okay? Because I want to make sure I don't miss out on anything. I think it's so good. When I was doing my research and looking at different articles, I almost made 3 pages of different things that could, add to, but I'm not going to share all those things because I don't think it's important for you, and it can make you confused and make you want to log off of this video. And I don't want you to do that, okay? But if you have any questions about it, just let me know, and I'll definitely give you much more information and dive into that topic based off of your needs, okay? But like I was saying, I think about different factors that are adding to a patient's symptoms that they endorse to me, okay? If I say, okay, yes, you have major depressive disorder based off what they endorse, I have to start to think, okay, do I need to get labs, okay? Do I need to just get general labs to ensure that it's not something that we can just quickly treat? So I typically may assess for, low vitamin D, because vitamin D deficiency can show signs of like someone having depression, where they even have changes in their sleep patterns, even have problems in their attention and concentration. Then I think about, maybe low B12 or folate. Do they have history of hypothyroidism? Do they have any history of like anemia? These are different things that go across my mind, because these quickly can show signs of symptoms of depression and signs of depression that can be easily treatable through giving them that they need, replenishing with everything that they are low on, okay? And then I think about, like I said, how chronic illnesses, there was a study that was showing how people who have chronic or disabling medical conditions, there are increased risk of major depressive disorders, okay? And it was saying that they're more than likely to have severe episodes of depression in comparison to those who are medically healthy individuals. And so we have to think about those things when someone's coming in. I have to assess and see, is this depression due to the chronic illness that they're having? As you'll understand and see that depression is not just some pop-up thing in your head, but it actually goes deep into the pathophysiological beings of us. So meaning the cells, meaning the neurochemicals that we have in our brain, and not just even in our brain, the way that neurochemicals and chemicals transmit throughout our body. One of the main causes of depression is having a hyperactive HPA system. And so through that, it was showing that as you have an increased cortisol, that can make other things go haywire, because the cortisol is influenced through our glucose metabolism, as well as our fight or flight system, and how we break down things. And so if that is hyperactive for us, things can start to go haywire. And then that's where we have to think about socially, the social factors or the psychological factors, how someone may even already have higher HPA axis because of the stress they're having. And so major depression just makes it even more intensified. But we also know, as a psychiatrist, I understand that there's other pathways that could possibly be how a person has depression through what we call serotonin, which is a common neurotransmitter that is low when people have depression. But even in that, we realize it's not just one neurotransmitter that is due to it. I'm probably just getting a little bit too deep now. But neurotransmitters are the neurochemicals that are in our brain primarily, but it's also within other organs in our body, like our gut system. And so we realize that the low serotonin has shown that people experience depressive symptoms. But also we think about norepinephrine, which is a part of that fight or flight system that the HPA axis influences. And then we think about dopamine as well. So these are three common neurotransmitters that plays a role in how major depression shows up in a person's lives. And as a psychiatrist, I think about that because most of my medications that I prescribe works on these neurotransmitters in a certain way. And I won't get into detail about how, SSRIs are the first line medication treatment for major depressive disorder, but sometimes as I have to add an adjunct or add additional medication to help treat the resistant symptoms of depression, sometimes I'm adding like a dopamine, an anti-dopamine medication to try to augment with that. And I realize that is through how the serotonin affects certain parts of the brain, how how the amygdala starts to have impact on it, how the prefrontal cortex, which also is impacted by major depressive disorder, how it starts to have a low release of dopamine. And so we have to think about how dopamine, it plays a role as well. But I want us to understand that depression is not just something that's happening in the mind. Okay, it's not just someone is thinking sad and they just need to snap out of it. I just explained how depression is literally at the depth of the structure of our brain, and not just our brain, but various organs can definitely influence the way someone maybe have depression. because like I said, serotonin is throughout our body. And so some of the research people are having now is how our microbiome, or how even like inflammation throughout our body, but the microbiome that we have, and how people who maybe need prebiotics or probiotics to help them feel better because the serotonin in their gut maybe have dysregulation. And so we have to understand that it's not just a matter of the mind, but it's a full body. And so I hope that I was able to explain to you how major depressive disorder also is impacted and influenced by the body. And now we'll shift to how major depressive disorder is also influenced by our mind. And when I think about our mind, I think about how our thinking patterns, our coping skills, if we have, the inability to have resiliency in our thinking, meaning like if you're someone, if something happens to you, you quickly like go to 10, your reactivity, you have low stress tolerance. These are things where I think about the psychological factors that contribute to a person having major depressive disorder. I think about the psychological factors that's contributing to a person having major depressive disorder. And so, like I said, we think about their thought patterns, how they are having negative thinking patterns or distorted cognition, whether they're, constantly having difficulties with interpersonal relationships. So some of the things that you can think about, someone's constantly saying like, I'm unlovable, or I'm unworthy, or I'm broken. These are things that are not factual. But when you have this chronic negative thinking pattern that could be due to a false core belief, or a false, thing that you experienced in your lifetime that you allow it to stick to you, or someone you love allow it to stick to them. We have to challenge those things when it comes to being a psychiatrist or a psychotherapist, or even whether it's, a spiritual counselor, whoever it is. Those are things we have to target, because that could be what a person is making them more depressed. I think about how I'm training to be able to do cognitive behavioral therapy, and how the CBT model states that, the thoughts, and it can occur through event, or it can happen due to a belief, whatever it is, but the thoughts impact our emotions, and it impacts our behavior. And so if you have these negative thoughts constantly about yourself, about the world, it can influence your emotions, where you become more sad or become more depressed. And then it influences your behavior, where you're not going out as much. You're not, participating in things that you once used to participate. You're not socially engaging with people you once would socially engage with, because of a thought that occurred. And so that's where I have to think about psychologically what is adding to this presentation. Maybe I have to ask, well, how do you typically respond when you're having, stress? What are your coping skills? How do you adapt to certain things? I have to think about like interpersonal relationships. If you are with a loved one and you're constantly arguing, or think about the parent child dynamic, think about the marriage dynamic, think about the whole family structure dynamic, and how it influences a person's ability to think well, to be well. I have to think about all those factors. Another thing that I think about is, the attitude, beliefs, or just culture beliefs. I have to allow that to come into play. And that's also influenced, touch me, Lord, that's also influenced psychologically, but also socially, okay? And so I play those parts together. No, none of us are perfect, you all. All of us have problems, okay? If anyone is showing up in the space or showing up in the world as if nothing, bothers them, or they have nothing abnormal within life, that is false. We all have things we can continue to work on. And so this is not for, if I'm saying some of these things and it may be portrayed as if it's negative, I want you to understand this is things that we can all work on and improve on. Nothing negative at all, but certain negative habits can make us perceive our life as negative when it may actually not be. And that's where we have to, challenge those things, because that's where, therapy comes in, and medication comes in, and seeking treatment comes in, and even being a community of believers. And I'll get into the spiritual aspect soon, but we have to understand that just because you think a thing does not make it 100%. Some things are not true. Some things, our view that's going on around us may be skewed. And so this is the opportunity to offer hope, that just because you may be having moments where you're feeling like you're unworthy, that's where we can offer treatment of that. That you are worthy. You are worthy of life. You are worthy of love. You are worthy of the smile on your face. You are worthy of the breath of the air that you're breathing. You deserve it. You deserve more. And so that's where, as a psychiatrist, that is the conviction of my heart. That is what moves me to let people know that you don't have to suffer alone. And so despite what you're thinking, what you're feeling, or how you are behaving right now, that does not mean that is 100% permanent. That does not mean that it's going to be that way always. Eventually the tides will pass. Eventually the sun will shine again. And I firmly believe that. And now we'll look at some of the social factors contributing to a person who may have major depressive disorder, okay? And so remember I mentioned kind of at the beginning of this episode, how some of the risk of major depressive disorder is influenced by their environment, influenced by adverse childhood experiences or social determinants of health. These things can impact someone. It can impact them in a way that it's hard for them to find hope. It's hard for them to want to keep going. It's hard for them to want to live a better life, because this is where social determinants of health come in. Because like, if you live in a zone where you don't have healthy food or groceries, and say I mentioned certain things that can occur, say for instance, like you have poor appetite. Could it be that you have poor appetite because the foods that you have access to are not good, for your body? Could it be, the reason why you have insomnia is due to your environment, where you're close to something like a meal, you're close to something that has harmful toxins released? Those are social determinant health factor, because these things could be potentially negatively impacting the way that your body, the way that your body is growing and functioning, in a way that you have access to quality of care. And so I think about those things. I think about, does this person have transportation to get to visits? Does this person have not just transportation, does this person have enough finances to afford the treatment that I think would be best for them? Does this person have access to health care? So when I think about the social factors contributing to a patient's major depressive disorders, I think about, finances. I think about their access, like I mentioned to you, some of the social determinants of health. I think about it can even be their ability to understand what major depressive disorder is. I think about environmental stressors. I think about their support system. Do they have somebody to just support them, encourage them to take them to their appointments if they don't have appointment availabilities? I think about, if they're experiencing, discrimination, all those things. I think about, could these things be contributing to why a person is showing up this way or feeling this way? Because there's certain things that I cannot address, but I can help you cope with that. Whether it's, referring you to a social support system or referring you to social services. That's one thing I really like, is when we have people who understand where different resources may come from. People who have the knowledge of, okay, this place has the food bank. This place has, the location where you fill out application for jobs or community fairs. Like, that is necessary for me as a psychiatrist, because some of the things that is impacting a person and the way that they're showing up is actually things that are due to things that are going on in their environment. As a psychiatrist, I look at, and I'm trained to look at these diagnoses like major depressive disorder through the lens of biological, psychological, and social factors, contributors. However, as you all know, my podcast is built from the foundation of Jesus, and him leading me and helping me and transforming my life through the lens of being a Christian, okay? And so that is where this comes from, Ministry.Mom.Medicine. And so now I'm going to shift my focus to, as a believer, how I believe major depression is, can be influenced in our spirit. I'll go through in the Bible, share the story of Job, and share how God delivered him, but how actually Job was experiencing spiritual warfare about the things he was experiencing. And through God, eventually redeeming him and restoring him, but he can do that for our lives too. Sometimes what we're experiencing can be a matter of spiritual things that we're dealing with. It can be a matter of, our faith as well. That can be a picture. But I made sure I talked about the other factors, because I think sometimes people think it's just one thing that is influencing it, but it could be a host of things. And as you're able to see me talk about the biological factors, talk about the psychosocial factors, some of those things may be experiencing with someone in the faith that we have to address as well. Not just saying, oh, that was in me. Oh, that was the devil. And, I think, all those parts can be influenced and impacted when it comes to the spiritual realm of being a Christian, okay, from the perspective of being a Christian. So now we'll get into it, because we think about Job and how in the first chapter of Job, and I'm going to try to summarize this as fast as I can, okay? When we think about in the chapter of Job how the first chapter of Job, how, he was a righteous man, a devout man, a wise man. He was a blessed man in the Lord, and how the enemy, the devil, Satan, he was seeking who he could try. And he was searching the land, and the Lord said to him, have you considered my servant Job? And you can refer to this in Job 1:8. And so there was a certain thing that the Lord said he could not do. He said he could not kill him. He could not take him away. And so, but he can do all these other things, but he could not touch his body, touch his soul. And so, then we get into Job 1:13-22, where Job goes through a lot of trials and tribulations. He goes through a lot of trials and tribulations, where the point where all of his stock are killed, all of his children, is killed. He becomes sick to the point where he has boils on him. His body is sick and weakened. And then even his friends, at first we thought they were going to show up and be, encouraging and, lament with him, but eventually his friends turned against him and said there was something he was doing. So he didn't really have an adequate support system. And so we can apply that to some of the things I just mentioned about how major depressive disorders can show up. How Job, he was experiencing the isolation. Job was experiencing the chronic illness. Job was experiencing the attack, where he was questioning what did he do? What did he do to deserve this? He started to have those negative thoughts happening for him, to the point where he even started to have thoughts of death. Do you see what I'm saying? How Job, he even he was able to fit the criteria due to life circumstances that he was experiencing, but also his health started to get overwhelmed. So biologically, he was impacted. Socially, he was impacted. He didn't have as much money he once had. He did not have as much beneficial things that he once had. He didn't have such a high degree in the land that he once had due to what was going on with him. And so he had the social factors. He had the psychological factors where he started to question things. His mindset started to be challenged, but he never did curse God. Ultimately that's what the enemy was trying to do when it comes to the spiritual aspect, the spiritual warfare. Because when I discussed this to you all over the first 3 episodes, as a Christian, a believer, we know that the enemy comes to steal, kill, and destroy, but we know that our Jesus came that we may have life, that we may have it abundantly. And so we have to understand that aspect of it is that the enemy wants us to throw in the towel and not continue to believe in our Jesus, not continue to believe in the promise that the Lord has for us. But we know that his promises are yes and amen. We know that he'll never leave us nor forsake us. But we see in this story that Job experienced all the factors that I just mentioned to him, but he yet continued to stand. And so as believers, we have to yet continue to stand despite the circumstances that we may feel. Despite us having major depressive disorder, we have to know that eventually a sunshiny day is going to come again. Eventually the rain is not going to continue to pour down. Eventually my health is going to improve. Eventually my thought patterns are going to change. Eventually I will be encouraged. Eventually I have the social support system that I actually require and need. Eventually it will happen. And we see Job, that did happen for him. Eventually it did. But what I like about Job is that he did a lot of talking, a lot of lamenting. One of the things that I think that is problematic in our culture is that people aren't able to talk. People are not able to be vulnerable. People are not able to really say what it is. They're not able to call the duck a duck, but they have to sometimes conceal, they have to sometimes hide, they have to sometimes fake it until they make it, and that can be hard. You know what I mean? That impacts someone where they feel like, okay, if no one I can connect to and hear me, maybe the option is, I don't have anybody. And they start to believe the lies even more, especially when it comes to warfare. And so that's why we can't do this thing on our own. And that's why I think I am called for such a time as this. And that's why I don't question why I chose to be a psychiatrist. I don't question the reason why I do this, because I know there's a need in my community. And I think the community, yes, is those around me, but I also think there's a need in the community of believers, because people have to know that there's people biblically who had some of the symptoms of what we call major depressive disorder, but we would call it in the text just really despair. His circumstances was hard. And so he went through a lot. You can refer to Job, the 2nd chapter, 7-8, where you want to refer to the boils or the painful sores that he had. because I don't like for anyone to think that I'm just making up things. I like to give the scripture where it's coming from. And so you can refer to Job, the 1st chapter, 8th verse, Job, the 1st chapter, 13th through the 22nd verse, and Job, the 2nd chapter, 7th through the 8th verse, when it comes to different things that I just mentioned to you. But all in all, you can read the entire chapter of Job. All, I want to say 42 chapters. Amen. But I want to read this verse in New Living Translation, okay? This is Job, the 7th chapter, the 16th verse, NLT, okay? And what I'm going to do, I'm going to make sure this is still recording, all right? Because sometimes we run out of data. We can refer to Job, the 7th chapter, in the 16th verse, New Living Translation. It says, I hate my life and don't want to go on living. Oh, leave me alone for my few remaining days. Job started to experience a lot of despair, and it started to impact him. And so the reason why I wanted to highlight this verse is that sometimes we are telling each other that we just need to be strong and just endure and you'll get over it. And yes, eventually days will pass, but we have to understand Job, he was experiencing some negative thoughts to the point where it was impacted to the point where he was thinking, death would be better for him. And that goes to the severity of sometimes how depression can impact someone, whatever it may be, why the person may have major depressive disorder. Like I said, I explained different factors that contributes to whatever the person may have, whatever thing that I'm able to conceptualize about this person. I have to understand the depth of their life is valuable, but maybe they don't see that. And Job experienced that himself, okay? But he was able to continue to talk to God throughout what he was experiencing. And it took time. It took a lot of time and work and effort with him and God going back and forth till eventually he started to call and see who God for who he really was, and how he was a redeemer, how he was perfect, he was mightier, and he was more wiser, and he knew everything. He was exactly who he said he was. Amen. My ball tried to come down. And so we have to understand that as a community of believers, the spiritual aspect is that we have to call it what it is, but not just sulk and sit in it, of course, but let's be real about what we're experiencing and talk to people, because believe it or not, people who are in the faith are having thoughts of not being alive. And that's unfortunate and sad. And that's where we have to, I say, plead the blood of Jesus. That is where we have to pray and fast for sure, but that is where we have to get them help. Okay, that's where, and maybe you're on the video and you are experiencing that. You are loved. You are not alone. You are important. God sees you. And it may be, you may be like, Dr. Taylor, you are just saying that. No, I truly believe that and know that he loves you and he sees you. Do not give up. Do not throw in the towel. Do not feel like, your life is not important, because you are. There's a lot more life to live and breathe on. And let me tell you why I know that. I know that because he's been good to me despite the hardships that I experienced in my life. I know my God is yet faithful. I know he's yet sitting high on the throne, and he's looking low, and he's interceding on my behalf. And as he's interceding on my behalf, he can do that for you as well. So you just call on his name. Anytime you're feeling like your life is not worth it anymore, you say, Jesus, help me. You know what I mean? And he can definitely do that. Because we'll refer now to Job, the 42nd chapter in the 10th verse. Because this is why let me get my phone and go to it. Because in Job, the 46th, Lord help me, excuse me. In Job, the 42nd chapter in the 10th verse, we see that the tables did turn. Eventually he was restored. Eventually he was blessed again. And that same thing can happen for us. What you're dealing with right now, what your family may be dealing with right now, it is not permanent. Things eventually can change. It can. No mistake is too big. No mistake is worth your life. It's not. And so that's where we have to just trust him and believe in him. And like I said, there's biological, psychosocial, and spiritual factors that I believe that impact someone major depressive disorder.